Jerry Canterbury was only 19, but a fiery pain that shot down his back made him feel 100. It had started after a fall at work, a dull ache that grew into a constant, sharp complaint. It stole his sleep and his plans for the future. He lay in the sterile white bed of the university hospital, the crisp sheets, a stark contrast to the turmoil inside him. Dr. William Spence, a neurosurgery resident with sharp eyes and hands he hoped were even sharper, reviewed the chart in the hallway. A problem with a disc in the spine. A simple operation was the clear solution. It was a procedure he'd assisted on dozens of times. He was confident, ready to prove himself, and certain he could fix the young man's problem. "We'll make a small incision, fix the disc that's pressing on the nerve," Dr. Spence explained to Jerry, his voice calm and reassuring. "It's a straightforward procedure." Jerry looked at the doctor, his young face serious. "Is it safe? Are there any risks I should know about?" Dr. Spence offered a practiced smile. "It's a very common operation. You'll be back on your feet in no time." He spoke only of the benefits, the relief, the return to a normal life. Later, under the hum of a desk lamp at the nurse's station, Dr. Spence paused. There was a risk, a 1% chance of paralysis. It was a whisper in the statistics, a ghost in the data. Mentioning it would only frighten the boy, possibly causing him to refuse a necessary surgery. Was it his duty to voice a fear so remote? He decided against it. His job was to fix the problem, not to cause needless worry. The surgery went smoothly. In the bright, focused light of the operating theater, Dr. Spence's hands were steady. He moved with the precision of a watchmaker, relieving the pressure on the spinal nerve. It was a success. A textbook case. He felt the quiet satisfaction of a job well done. In the recovery room, Jerry drifted through a fog of medication. The sharp, fiery pain was gone. Dr. Spence left routine post-operative orders with the floor nurse. Keep him comfortable. He'll be fine. He did not specify that Jerry would need help to get out of bed. He did not order the bed's side rails to be kept up. Hours later, in the deep quiet of the hospital night, Jerry awoke needing to use the restroom. His mind was still cloudy, his body weak. He swung his legs over the side of the low bed. He tried to stand, but the world tilted, and he slid to the cold, hard floor. The urgent call woke Dr. Spence from a restless sleep. He ran to Jerry's room. The young man was back in bed, a nurse hovering over him, her face pale. I can't feel my legs," Jerry whispered, his voice trembling with a new and terrible kind of fear. Dr. Spence stared at Jerry, then at the low side rails of the bed. The boy's unanswered question from before the surgery echoed in his mind. Are there any risks? The 1% chance, the risk he had deemed too small to mention, was now a devastating reality, born not from the surgery, but from a simple, preventable fall. The fall had caused a catastrophic injury. The question was no longer just medical, but moral. Had Jerry truly consented to a procedure when he was denied knowledge of its gravest risk? For Dr. Spence, the case would become a lifelong lesson. A doctor's duty is not just to heal the body, but to honor the patient's right to choose, a right that can only be exercised with truth.